Hi, this is Josh, pharmacist with Pharmacist Tips. I'm going to discuss the medication Phentermine. I'm going to talk about Phentermine. It's commonly used for weight loss. We'll discuss weight loss that can be expected from Phentermine, as well as we'll discuss some of the potential side effects that can occur with the medication. So what is Phentermine? Phentermine is a stimulant. It's a stimulant that reduces appetite. In the US, the brand name is Adipex P. However, there are several different generic formulations available in capsules and tablets. Primarily, that is what most prescribers use. There's also a product known as Lomera that's available. It has been around for quite some time. It was approved August 14th, 1973 by the FDA, and it is approved for short-term weight management. So how does phentermine work? It acts similar to amphetamines in the body. It increases the neurotransmitter known as norepinephrine. It also inhibits what's called the reuptake of norepinephrine and dopamine. That means they stay in the nerve synapse longer, and that provides some of the effects that people report with the reduced appetite. Some people feel an increase in energy as well as an improvement in mood, all due to those neurotransmitters. What are typical doses we see with phentermine? Again, it's indicated for short-term use. Typically, we see about 12 weeks. Your prescriber, of course, will help you determine the appropriate dose and length of use for you. You can develop some tolerance over time. That's why it's indicated for short-term use. Typically, that dose is going to be anywhere from 15 to 37.5 milligrams once daily in the morning. Most often before breakfast, but sometimes some prescribers may have you take that in the mid-morning. The exception would be Lomera. Lomera is a lower dose. It's 8 milligrams up to 3 times a day, taken 30 minutes before meals. It offers a little more flexibility. Some people just need a little help with their appetite only certain times of day. You know, if you have increase in appetite in the evening, it's possible with just one dose in the afternoon or prior to your evening meal can help suppress the appetite, and that's all you need. There is also a product called Qsymia where it's combined with topiramate. That I will cover in a separate video. What about some of the side effects that you can see with phentermine? It can increase blood pressure and heart rate, and so that will limit its use for a lot of people, and we'll get into that in more detail in the next slide. Gastrointestinal side effects can occur. Constipation, diarrhea, other things like that have been reported. Some people do get some dry mouth. A change in libido and impotence has been reported. Dizziness, headache, restlessness, and euphoria also reported. One does need to be cautious when operating vehicles or machinery until they know exactly how this medication will affect them. Also, muscle tremor can occur. The warnings and contraindications. So who shouldn't take this? We just saw that it can increase blood pressure and heart rate. So those with cardiovascular disease, this medication would not be a good idea. If you have a history of heart attack, stroke, heart failure, certainly this medication would not be for you. If you have hyperthyroidism, so hyperthyroidism where you have too much thyroid, you're already going to have some of these heart rate issues and things like that. So this could compound those issues. Certainly wouldn't want to use phentermine. It can aggravate glaucoma. Those in agitated states, if you have a history of a lot of anxiety, stimulants like this could increase that agitated feeling, that anxiety. So certainly, if used, would need to be very cautious about dosing, monitoring how you feel while you're on the medication. History of drug abuse, simply just due to the potential euphoria feeling. If you have misused drugs in the past, this may not be a good idea. Also, it should be avoided in pregnancy as well as breastfeeding. And if you're taking any MAOI inhibitors, you would want to avoid phentermine. Let's take a look about how much weight loss can occur. I will include a link to the study in the video description. But what they did, they looked through several different studies of weight loss medications to see how effective they were. And so let's take a look at what kind of weight loss could be expected with phentermine. The studies did range anywhere from 2 to 24 weeks. I would think most people probably saw these results around 12 weeks, and they did see a mean weight loss of 3.6 kilograms, so that's about 8 pounds. All right, so if you found this video interesting, I would appreciate it if you would like the video and subscribe to my channel. I do appreciate you watching. And do remember, this is for informational purposes only. Always talk to your healthcare provider for more details about prescriptions that are appropriate for you. Thanks.